Let's turn to Dr. Jen Caudle. She's a family physician associate professor from Rowan University. And Dr. Caudle, we are still having this debate. In fact, it's kind of heating up a little bit because they're talking about, chloroquine, right, and zithromycin and the combination of both, especially in the wake of this French study, which seems to a little bit say, look, all of our patients have improved by using this. And I'm quoting from the study here, despite its small sample size, our survey shows that hydroxychloroquine treatment is significantly associated with viral load reduction, disappearance in COVID-19 patients, and its efforts is reinforced by azithromycin. So you have scientists on the other side saying this was a small study, there was no empirical testing, this whole thing should be thrown out. Your thoughts?
My thoughts are what you started out by saying, which was there was a small sample size. I am hopeful for any treatment that we may come up with that might help fight COVID-19. I am not a Debbie Downer. Let's just be very clear. I am very hopeful. However, I am also a scientist. I'm a physician. And I know that one trial that's small or small numbers of trials that are small and not validated and extensive don't necessarily mean that a drug or drug combination will work and be safe. Remember, it's not just about whether these drugs work. It's also about if they're safe for people to take and how we need to dose them and how often they need to be taken. There's a lot that goes in here. So while I say, a lot of my patients are asking me about this drug combination, I'm saying we just don't know right now. Am I hopeful? Certainly. Do we need more research? Absolutely.
Does it change your view at all? I mean, and I know that this has been used for malaria. We're talking about chloroquine for many years for malaria. It's also been used for lupus, and it's also been used for arthritis in some capacity. There are some testing going on right now for COVID-19, but it's been used. It seems to be, over the years, fairly safe. Does that comfort you at all?
It does in some ways. You're right that hydroxychloroquine in particular is often used for lupus, et cetera, and things like that. What's nice about it is that it's not a brand new drug. But remember, there's still things we don't know about it. Just because we've used it for other conditions doesn't mean that we would know if in the context of this disease state, if it's safe, if it's effective. At what dose, at what dosing. So you understand. So yeah, I love the fact that it's a drug we're familiar with, but that does not mean that, there's still work that doesn't have to be done. There's still almost just as many questions. And that's why it has to be studied rigorously. We need to make sure that not only does this work, but that it's safe for people. And we don't know that right now.
Yeah, I was interested today when Dr. Deborah Birx came out and she was talking about the mortality rate, and she seemed to have some kernels of positive news in there. I want you to listen to this, and I'll get your response on the flip side.
Sure.
There has been no child under 15 that has succumbed to the virus in Europe. There was the one 14-year-old in China. So we still see that there is less severity in children. Still 99% of all the mortality coming out of Europe in general is over 50 and pre-existing conditions. The pre-existing condition piece still holds in Italy, with the majority of the mortality having 3 or more pre-existing conditions. But it doesn't change the need to continue to protect the elderly, and in order to protect the elderly, we all need to continue to do the president's directives and guidance.
Yeah, she says it should be reassuring. Are you reassured, Dr. Caudle?
In some ways I am. I'm reassured in the sense that that is sort of what we've been predicting all along. That's what we've been saying, that it tends to affect the elderly and people with underlying medical conditions more severely than those who are young. I'm glad to see that our feelings about that are still continuing on trajectory. That is a good thing. Let me just remind ourselves, Trace, I think we talked about this last week, that just because it doesn't affect young people as severely overall, we know that there are plenty of young people that are experiencing very severe cases of COVID-19 and even dying from it. So we don't need to let that be lost on us that yes, less than 1% or whatever the number she gave may be young people. That doesn't mean none. And it's still happening. And her other point, which we have to remind ourselves, is it does not exempt young people from being responsible and having a role in this. They can still transmit it to older people and other people. They can still be asymptomatic carriers. So they are still just as important as they always were in terms of COVID-19.
Do you get the feeling, Dr. Caudle, that you see the administration kind of dropping these good news tidbits as a way of greasing the wheels because they're going to start lifting some of these mandates later on in the week, some of these stay-at-home mandates?
I'm not sure about that. I don't know that I'm thinking about this as greasing the wheels. I think it's a good question. The way I'm hoping is that they're simply giving us facts. That's what we need right now is we need facts and we need data. And the best we can do really is what it seems like we're doing is looking at Italy and South Korea and China to see what the trends have been. So once again, I am still cautious in the sense that we know with this disease state, pretty much every day has been different. It is not unreasonable or necessarily unlikely that things could change even the next few days. So no, I don't think they're greasing the wheel. I think they're telling us what they know to this day and time, and that's what we need.
Yep, it's a fair assessment. Dr. Jen Caudle, good information as always. Thank you.
Thank you.